I think that, with children, you're right. There is this, I'm likely not the first person that they've seen with a particular issue that's going on. Sometimes I am if the parent has a tick-borne illness and then the child gets bit by a tick, I am the first person that they see, right? And those, there's a huge difference between recent tick-borne illness or tick bite that could potentially be illness. What do we do about it? And them looking at me as the first line of sight because they have experience already in that realm and prevention. And many of those cases are, 6 weeks of treatment. They feel really comfortable hitting it hard, aggressive because they know the sequelae that could be there. They've done all of their due diligence in regards to testing the tick and, getting as much information out of the tick. And so we really go in with a lot of arsenal of what to do in that scenario. The more complicated pediatrics is, cases that come in that have autism or spectrum disorder or neurodivergence, is another terminology more used now. But some do have a clear diagnosis that way, and some really have an array of symptoms that don't quite fit any particular box, but there's an instinctual component to either the mom or the dad that something is not right. And so kind of, again, it's layers in many of those cases. I think the most challenging component is where I feel really strongly, whether that be intuitionally or whether that be just based on what the labs are showing us, that we need to treat more aggressively than what the parents are comfortable with treating more aggressively. And I really just try and lay out statistics in regards to kids tend to do remarkably well, and their recovery ability is very good in regards to whether that be the microbiome of the gut. I think that's the biggest concern for most parents, that we're not going to be able to get their GI back to where we need it to be. And I would say far more often in kids than even adults, that's not a true statement, that we are able to really successfully get them back on track post antibiotics. But I will say I meet everybody where they are, and if we want to start with an herbal regime, then we do. And I also really encourage them to very much track. Okay, we're seeing a clear, steady upward trajectory, and then that plateaus. And sometimes it's in that plateau that we might be able to do just a short burst of an antibiotic regime for tick-borne illness, and then go right back to an herbal protocol to continue to get that continued trajectory up. In most cases, a child that comes into me, like I had a 5-year-old nonverbal 5-year-old, and we did treat for Lyme and tick-borne illness in that case, but it wasn't until we actually hit more of the parasitic infections and heavy metals in that case that we started to really see huge progression in his verbal ability. So just because we have a diagnosis doesn't necessarily mean it is the only diagnosis. And there's no way for me to know whether, if I've got 4 diagnoses, do they equally contribute to this case? Are they 25%, all 4 diagnoses, 25% of the case? Or are we putting all of our focus in Lyme and tick-borne illness that's really only 5% of the symptom picture for that case? And I need to cast my net much broader in being able to see, what else could be contributing to this case to hit that other 95%. And I think that's the biggest, I would say, treatment in general, not just pediatrics, but I think it's the biggest downfall that we have, is that somebody comes in with a clear case of, Babesia, Bartonella, Lyme, and And I'm not denying or disputing that we shouldn't treat that. But if we're not getting resolution to the case, even though those labs are negative, go further. Look a little further. What else is going on in that particular case that will really expand their level of health beyond what they imagined it to be, even?